cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. But tonight we're going to be doing a little curveball to that. We're going to be talking about IPV therapy, and we have an action-packed program. We're going to get right to it. You're in for a treat tonight because we have Lou Biasi, Vice President of All County Healthcare Incorporated, sponsor of this show, in studio, and also Jane Park, who's an RN. And Lou, let's get right into it. So you've known Jane for over 2 decades, over 20 years. How'd you guys meet, and why are you sitting here today?
Well, David, thank you. And Jane, I want to thank you for coming on all the way from Jacksonville. And I met Jane 20 years ago. Jane started a little pediatric home care. And I had a little home care business up in Jacksonville, which we specialized in private home care at that time. And eventually went Medicare up in Jacksonville. Jane became a good friend of ours, and her whole family, Jane and the children. As a matter of fact, Jane's kids worked for me for a while. Mm-hmm. And I got Jane taught me a lot about the business, and so we've been close friends for 20 years, and we've passed things on back to each other. Jane's specialty, of course, is pediatric home care. So she deals with a lot of infants. So grandmas and seniors that are out there, I'm sure you have grandchildren, and Jane specializes with pediatric children that have problems. Physical problems, and some of her children have cystic fibrosis problems, where she knows that our IPV treatments with our therapy has worked tremendously well. Am I correct, Jane, with that?
Absolutely.
And it's worked very well with him, hasn't it?
Yes.
Now, Jane, you've been living with for Roger, your great husband, for a number of years, right, Jane? 48 years, Jane and
Congratulations.
Roger together.
That's fantastic.
And I know Roger was a heavy smoker one time.
He was. He was also a chemist, which contributed some of the inhalation that he had to do with the chemicals that he worked with back then. They didn't realize the dangers down the road of working with those chemicals, and so the combination of the smoking and the chemical inhalation contributed to COPD.
And I didn't realize that Roger was basically a COPD patient. And he's up there at Mayo, and he's on the advisory board at Mayo, and he's been all over. So Jane said, Jane called me up one day, and she says, what are we doing? What's next on the agenda? She says, because she's a very, very active businesswoman, she's always looking for that next deal, right? And I said, well, Jane, as I'm getting up there in age, let's talk about what's happened in the past. So, she's been very fortunate. She had a very successful practice. She told me that Roger was suffering from COPD. I said, are you serious? She said, yeah. I said, well, she was coming down to visit us. She brought Roger down. I said, gee, I got a Dr. Robinson that's a renowned pulmonologist. Now, remember, he's been up at Mayo, one of the best clinics and facilities there are in the country, up in Jacksonville. And I'm not knocking Mayo, but, IPV is a relatively fairly new treatment. It's been around for years, but we brought it down here in South Florida, and it's been used extensively for individuals who have IPV, who have basically COPD, and can't exasperate. So I've asked Jane, come on down and meet Dr. Keith Robinson, who she met, a pulmonologist. And Jane, you've been with Keith now for a couple of weeks. You came back down again, and tomorrow you're doing some pulmonary function testing.
Yes.
And Roger and I was going to go, we hope to have him go on the IPV treatment to see how he responds to it. How difficult it is to live with a COPD patient?
Well, it's very difficult. It's changed his quality of life because he was very active, and now he is on oxygen pretty much all of his waking hours. He's not sleeping with oxygen, but during the day he has to carry that oxygen around with him. It's just his stamina is low, and we tried the IPV about 2 years ago. Someone had from your organization had let us use one for about 30 days, and it definitely made an improvement. The problem is there's no payer source for adults. It does pay. Medicaid pays for the IPV for my patients who are ventilator dependent and have other respiratory issues. It does pay for that. So after the 30 days, that was the end of what he could do. So when we came down to see Dr. Robinson, he evaluated him and did change some of his medication. He's been on sort of a traditional COPD regime as far as medications go from Mayo. They've done a great job. They just don't have the IPV as part of their offering.
Yep. And that so that only lasted for 30 days, but this is something that needs to be done on a regular basis to break up the congestion, right?
What Jane just said, which is a crazy thing, we've been trying to get Medicare to pay for the IPV for the seniors, and we're constantly doing clinical studies to show how this is so beneficial. They'll do it for children with cystic fibrosis and respiratory problems, but they won't pay it for adults. So seniors out there, if you have a problem with COPD, write to Medicare and say, listen, I want to know more about this IPV treatment, and where can we get it? So Jane didn't even realize where you can get the IPV. And since we purchased it 5 years ago with one unit, and the IPV unit is called, see if I tell you this right, interpulmonary percussive ventilation. Am I correct?
That's
interpulmonary percussive ventilation. What that does, it helps bring up the secretions that the patient can't get out on his own, which he's suffering from. And when your patient, and I asked Jane today, I says, what's his biggest fear? Well, Lou, his biggest fear is, am I right, Jane, when he can't breathe?
Cannot breathe.
When he can't breathe, you think you're going to die. So
it's like they're drowning.
Like you're drowning. So, I lost a friend like that. He couldn't breathe. He died basically choking to death. So I know there are a lot of seniors out there in this community, in the South Florida community. I'm talking about Palm Beach, Broward, Dade County, that have COPD. You're hearing it firsthand from a lady who's living with it, who's a nurse, who didn't know about it, right? Now, we at All County have made it our mission to go out and try to take patients who have COPD. We don't get paid for the unit, but we will get paid for the nursing. So we're not charging you for the unit, we're charging you for the nursing. We just want to prove that you get a better quality of life. And, most companies won't do it because they won't make the investment. It's a large investment. So they have the old traditional method where they use the vest, the nebulizer, et cetera. And the patients, they're not going to get, you're not going to cure COPD, am I right, Jane? It's not curable.
There's no cure.
No, there is no cure, right?
No, there is no
But
cure.
it's getting them a better quality of life, right? If I can get Roger off his oxygen 12 hours a day, where he can go play golf or tennis, his quality of life changes drastically. So what we're trying to do now is make sure that Roger gets these COPD treatments down here while he's here, and to see that if he gets these COPD treatments, how his life's going to change, his quality of life's going to change, and he'll probably continue this if this works for him, which we're pretty sure it's going to work for him, because our respiratory team, headed up by Ed Salazar, we're going to make sure it does work for him. And what we're trying to say, Jane is here. She's a person that lives with a patient with COPD. And I know, Jane, I'm taking up all the time, so I'm sorry.
That's okay.
But please tell us the difficulties. I know you're driving the car. You're with him.
Everything he used to do for us, I now do for us. I take out the trash.
So she's been the now she's the caregiver.
I'm the caregiver, the caretaker. It's not because he doesn't want to. It's just because he does not have the physical capacity to do it. So it's an everyday, 24/7 job.
It isn't a question. It's a question if he tries to walk or go swimming or something like that, he's out of breath. So the fear sets in. I think, Jane, would you agree with me? A lot of the fear sets in where a lot of it might be psychosomatic, but not only is it psychosomatic, he knows how he feels, and it's fear. The fear when you can't breathe. I know you patients are out there that are suffering. Please listen to me. If you have COPD, or you have a respiratory ailment, and you're in and out of the hospital, hospitalized a lot. Because some patients get in and out of the hospital with this thing numerous times. You know, Mrs. Bush, President Bush's wife, at 90-something years old, she was going in and out of hospital COPD treatments. Well, she had an IPV at home. She wouldn't have probably passed away. She would have gotten those treatments at home.
Could have broke up
probably
the
lived another
congestion.
2 or 3 years.
Because the article I read is that the congestion was so bad with Mrs. Bush that it ended up making her heart work harder.
Of course.
And that's
Of course.
why she developed congestive heart failure, which eventually, she died
Right,
because
and
of the congestive heart failure, which came on because of COPD not being broken up.
Well, Roger's got a vest at home. Lou mentioned the vest. That's the external way of doing what the IPV does very ineffectively. The IPV does effectively within the lung. So the other thing is the vest is incredibly cumbersome. It's large, it's heavy. You have to find a place to keep it when you're not using it. And it's full of hoses. It's just a very cumbersome. And what happens is it's so cumbersome, they don't use it.
Yeah.
So
'cause
it just sits in the corner.
quality of life is just too cumbersome,
It
like you
just
said.
shows you. Medicare pays for the vest. I'm not making Medicare. Agencies that have the vest, Medicare will pay for that. They give them that treatment. But the patients don't stay in compliance with that treatment.
No.
They don't keep using it. It's too cumbersome for them. It's like some people that have to, I have sleep apnea. Well, wearing that mask is, to me, is aggravating. So I decided I ain't going to wear that mask anymore because I'm not complying with the mask, right?
Yeah.
But I know I should be complying with it. But the fact that with the COPD treatments, it's only a 20-minute treatment, 7 days a week. For the first
it's
week,
almost comparable just to a nebulizer treatment, with which anybody with COPD is very accustomed to taking 1 to 3 or 4 times a day. So to take this 1 time a day and have it be as effective as it is really.
And you said it before, Lou, your treatment, the IPV treatment, is intrapulmonary, so it's going into the system, where the vest is extra pulmonary,
Right.
so it's outside,
And it's
breaking it up
it's the old idea of a pound, the respiratory pounding on your
to
chest.
break up the
Right.
congestion.
right.
But
But
you-
it only vibrates the exterior.
That's the vest.
That's
Yep,
the vest.
correct.
And so you take the IPV, it comes down and it goes into all of the alveoli and all the sacs that are in there. They're getting pounded from the inside to release that.
I'm looking at a picture on allcountyhealthcare.com, has a picture of the IPV machine, and a man is using it. So take us into a little bit, your experience with it. It's something that can be in the house, maybe to the side, and when he only needs it for 20 minutes a day, he actually sits in a chair and can use it. It doesn't look very
It has to be
cumbersome.
administered by a nurse.
Okay, so a nurse has to come.
A nurse administered that's basically trained out of the IPV unit. She's one of our
see.
she's one of our respiratory team members. We have 6 or 7 of our nurses have been trained to treat IPV
Got
with
it.
the IPV unit. Each patient gets their own mouthpiece where they breathe in. Now, All County pays for that mouthpiece. It's $100 each for the mouthpiece. We don't charge the patient. We want to see if this patient is working. If it does, ladies, gentlemen, those that are out there, IPV is costing Medicare billions of dollars a year with the readmissions to the hospitals. We're trying to do is just cut the readmissions down, right? So if you know a patient that has IPV and he has a physician, I talked to a patient today. He says, "Well, my doctor wants." Listen, if you have congestive heart failure, you're not going to go see a urologist, right? So if you have IPV,
COPD.
you have COPD, and we're the only agency that has the IPV. Yeah, I'm pushing our agency because we know we can help you. Ask the doctor that you want to try this IPV treatment that All County Healthcare has. We're a 4.5-star rated company, right? Basically, our nursing care is probably the best around, right? And we can tell you, honestly, you have nothing to lose by trying it. Am I right?
There's no cost.
There's no
because
cost.
Medicare pays for it.
Medicare
There's no
pays for
charge
it.
for the machine.
So the factor is, you can stay on it, and if they just keep working for you, we can basically keep you on it for a while. We've had patients on it for a year, right? But guess what? They didn't go into the hospital. One hospital stay for 4 days, 4.5 days, can cost you up to $65,000. The hospital,
Ouch. Yeah.
right? That's what the hospitals are paying. And if you see the amount of patients that are in and out of hospital respiratory, I have a friend of mine. She was 92. She came down here for the summer. She developed pneumonia. All right. Now, she been in 2 weeks. She was in and out of hospitals 5 times because she has COPD. When they get the excretion out, they send her home. She develops the problem again. She has to go back in the hospital. The idea is try to get these excretions out before you can't breathe and get it out so you can live at home. And that's what we're trying to do with Roger. So now we can get Roger, give him the treatments. I think Jane now, she won't have to be with him 24 hours. Maybe she even wants 12 hours. Gives her some respite care. You know what I'm saying? Jane will get some respite care to do what she wants. Because I know Jane, she had a mother that she took care of for years. Right? We both were in the same situation.
Yeah.
I was taking care of my dad. She was taking care of her mother. So, she's taken care of her mother for years. Mother lived with her for a while, gave her great care. And now as we grow older, she's got the same situation. She's a caregiver again, right? So I always say, folks, it isn't easy being a caregiver, right? But if you've got a treatment out there that can help you, if you're suffering from COPD, remember, and I'm just telling you this, go to our website, www.allcountyhealthcare, read about COPD, and if you do have the problem, it's, what happens, Jane, I was talking to you over lunch, patients don't know where to go. Patients don't know what to do. Mm-hmm. See, patients don't realize it's their choice. They can use any agency they want.
That's right.
You don't have to use All County, but if All County's got the program for you, try them. You got nothing to lose.
Exactly.
Right? If the doctor decides he wants to send you another agency, well, you can say, is that agency an IPV? And if he doesn't know, say, well, I know All County has. I want to try this company, All County. It's your choice. See, people don't understand that their health care is in their hands. Mm-hmm. They have physicians that they trust, which is wonderful, but health care is in their hands. And they don't really, I was telling Jan again today, Jan, I get 4 to 5 calls a week. That people's dad's in the hospital, kid got in the hospital, family members in the hospital. What do I do? Most patients don't know where to go or what to do. Once that patient gets into a hospital, they're lost because they're dealing with a case manager, and the case manager wants to get them out of the hospital as fast as they can. Can I put them in rehab? Can I go here? You ask most of these patients what kind of insurance you have. I don't know. Some are on Medicare Advantage, some are on, Humana, some are on United, some are on straight Medicare. So the answer, first of all, find out the kind of insurance that you're carrying. And if you're not on Medicare, get back on Medicare, straight Medicare. I'm not knocking HMOs, Humanas, right? But when you get sick, you want to go anywhere you want to go when you get sick, if you're on straight Medicare. So I'm glad Jane did come down to visit us. She's going to be down again. And I'm glad she was willing to come on the show to discuss her story about living with a COPD patient. Now, Jane, you're going tomorrow to visit Dr. Robinson, correct? Yes. Mm-hmm. He is an outpatient pulmonary clinic. And I also understand that Shands, up in your area in Jacksonville, has 4 of these IPV machines.
They do.
Oh, wow. Shands has put forward because they do a lot of peds up in Shands, mm-hmm. and they do a lot of,
And the pediatric hospital, Wilson's, has that's part of their protocol, right, to use the IPV on pediatric
with the children.
Patients. Yes.
Pediatric, mm-hmm. But no options for adults.
No options for adults at all.
Yeah. That is something.
But guess what? We made a presentation. Ed Salazar and myself made a presentation to Cleveland. They accepted an IPV unit in their outpatient pulmonary.
This is Cleveland Clinic in Weston, right. Florida here?
Right. FMC, Florida Medical Center, down in Fort Lauderdale. They called us and said, can you help us with our readmissions? We did a big in-service for them. Now they're sending us patients. We did a patient again, North Shore, which is part of Tennant.
North Shore Medical Center, correct,
right,
in Miami.
They realized they got a lot of COPD patients. They want to cut back these readmissions. So it takes time to make people aware of what you got, right?
Exactly.
And that's why this show, so we want to try to keep the show informative enough to say, you've had different doctors on, different physicians on. We've had call-ins. This show hits almost, I was telling Jane, this show hits almost 3 million people a week because it's on all the iHeart stations. Now, we've been getting calls from, as you know, David, from Canada.
Yep.
We've been getting calls from all over where they set appointments up with patients.
London,
We're doctors, London, New York City, so we can call
Indiana.
So people want to know more about what we're doing. And it's also on YouTube.
Yep.
So
and you're mentioning the shows. All the shows are on allcountyhealthcare.com. There's a link radio shows. And there's also, you were mentioning COPD care before. There's a whole link that you have on the website, allcountyhealthcare.com. If you click it right there, you can read about the IPV. You can read about the pulmonary hygiene team, COPD care. It's all right there. And I was telling you, Jane, we're on worldwide on Facebook Live.
Right.
On All County Healthcare, INC.
And if you go to our Facebook, you can see some people have written in and said how this IPV has helped them tremendously with their family members. You know, and you go to Facebook Live. There's nothing, I'm just trying to say, when more people you talk to, right? And they don't quite understand it, right? I visited a doctor today. Listen to this, a doctor. I had breakfast with a doctor today. He says, you've been telling me about this IPV. My father's got COPD bad. Right? I said, well, what do you get, Doc? What do you got to lose? So he's ordering COPD because his father can't leave the house. He's homebound with COPD. So we're going to start treatments when his own father. But here's a doctor that I've known for a while. He realizes, hey, I got nothing to lose. Right? Dad's got nothing to lose. Let's try it. And I guarantee it's going to find it so effective that we had one doctor, he sent me a patient that was ready to go to hospice. He said she's not going to make it. Well, she did make it. She made her granddaughter's wedding, which I've told a number of times. And when he took her back 2 weeks later after 11 treatments, he says, he called me personally. He says, I can't believe it. I didn't see it with my own eyes. He says, you got all my COPD patients, right? So whether you got concierge medicine or you got regular physician, short choice. You got COPD and you're having problems breathing, and you want to try the IPV treatment, there's no charge to you. Tell the doctor you want to go to All County Healthcare because they're the only one with the IPV.
Well, that's the thing. I've never heard of an agency that provides any actual machine that can make such a difference in somebody's life at no charge to them. So, there's nothing like that in Jacksonville.
This machine weighs 16 pounds. We bring it to the home. It's the same type of ventilator you would get in a hospital, but it's a compact size that we can bring to the home now. And what it does, it does, Jane tells you, it does the pulmonary function to help you get that excretion up that's very difficult for you to get up. The more excretion you get up, the better you feel.
Well, and the secretions are where the bacteria grow, which creates the hospitalization.
No, I see.
So you can't, if you build up the secretions in the small areas of your lungs that you can't cough out, then the bacteria sets up housekeeping, and then you're hospitalized. If you can use this IPV, get rid of those secretions, there's no place for the bacteria to live. So,
because the bacteria are living in the congestion.
That's right.
So this needs to be expelled on a regular basis. Let me ask you, you've experienced the seeing the use of the device when Roger used it. Now, how people are going to ask, how often did the nurse have to come and do these treatments? Was it how many times a week?
Well, I was his nurse.
Okay.
With that machine, they trained me how to use it, and I administered the treatment to him. And he used it every day when he had it.
Okay, so just 20 minutes a day.
That's all.
Okay, and during that time, he even told me in the waiting room here that he definitely saw, great results from it. He felt a lot better. The congestion was lower.
Well, even if you don't have lots of congestion, it expands those airways and allows you to breathe deeper and more fully. So, those airways are kind of locked down tight with COPD, but this forces those open.
It's a better quality of life.
Makes your respirations much easier.
And remember, then the fear sets out because he doesn't feel like he's going to choke to death or die, because now a lot of it's psychological, right? And if you have it, depends on how bad you have it, right? Now, we had a woman that was on it. She was about 400 pounds. She had a real bad. So she got re-hospitalized, but for congestive heart failure, not for COPD. If she was on that machine earlier, she probably wouldn't have had a congestive heart failure. But she says, I want to go back on the machine. I want to go back in the IPV when I get out of the hospital. And she did. See, the answer is once they try it and they get used to it, to them it's like an iron lung. Like they saving my life, right? I'm breathing. I can breathe now, right? We've had a fellow on it for 2 years up in Palm Beach. We couldn't get it out of his house, right? He was on it for 2 years. We had we had that patient on for 2 years. My phone should be on, but it's okay. So we've had people on it for 6 months, 7 months.
Okay.
We've had an individual down at Century Village in the middle of the summer, July of last year. The husband was on oxygen all day, just like Roger is. He was 80 years old. The patient now, after we give him 11 treatments, said to the wife, I don't think I need this oxygen today. He went swimming, came home, made love to his wife. The wife called, says, I want to buy the machine.
I bet, yeah.
Right? So I said, yeah, buy the machine. Well, he kept on the IPV treatments. So, folks, if you're out there, and I think Jane can attest to this, if you have COPD or you have a respiratory problem and you're homebound and you're entitled to home care, remember that All County Healthcare is the only company that's invested, put the money up, not getting reimbursed for your benefit so your quality of life will change, right? And as Jane told you, she's a nurse from Jacksonville, and it's very hard for her to get these treatments unless she comes down here.
Wow.
So now Cleveland is accepted in our program.
Cleveland Clinic in Weston.
FMC is now accepted. We gave an in-service to all the case managers. Not Shore has accepted it. How many more?
We only have about a minute, so let me.
Ask Jane. Let Jane, you finish it.
Okay, we're going to commercial.
Yeah, we need a commercial.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the show. We have in studio Lou Biasi, Vice President of All County Healthcare Incorporated, and Jane Park, who I've learned tonight is not only an RN, but an RN for pediatrics, which is of utmost importance. And you're now in the Jacksonville area, and we were talking a lot about IPV treatments that your husband has received, Roger, and how they've been so helpful. And I wanted to clarify one thing. I was looking it up as we were on right now because I got the computer right here. I'm watching what's going on Facebook Live with this show and all. But we were talking a little bit about the Mayo Clinic, and I'm always thinking Rochester, Minnesota, but there's actually a Mayo Clinic in Jacksonville.
There is.
So let me just clarify that right here in Florida, Northeast Florida.
They have a huge presence. They have a hospital, Mayo Hospital, as well as the clinic.
Oh, wow. It's kind of like, Lou, we have the Cleveland Clinic you were mentioning. I was making sure the one in Weston is where your IPV treatments are. Right. So I just wanted to clarify those two things.
And I want to thank the gentleman that should be on this half hour, but he said we're doing such a good job that he wanted to give us the other 30 minutes to inform the patients out there what's going on. So, again, thanks, Tommy, for allowing us to be on here 30 minutes. And it gives me 30 more minutes to talk to my friend Jane here.
Yeah, definitely. We got a good thing going. So you were telling us, Jane, that the IPV treatments are available in Jacksonville, but only for pediatric patients. And we were talking a little bit about maybe that's with pediatric patients that were the ailment of cystic fibrosis and other ailments, but is not available for adults
That's
in
correct.
Jacksonville.
That's correct. Medicare doesn't pay for it.
Okay.
Shands apparently does have some units, and
For
they may be-
pediatric use.
Well, we don't know. We don't. I got to ask.
Trying
Ed
to
whether-
find out,
It
yeah.
might be in some of their outpatient pulmonary rehab. It might be. I don't know if they're using it in their outpatient. But we know they have 4 units up there. Mayo, we're trying to. Ed's up there talking to people in Mayo to try to get in to see if Mayo will do it. But we're concentrating here in South Florida right now, and the South Florida market is a large market, and it's a large elderly market. There's a lot of patients who have COPD because either they got it through their work or they got it because of smoking or whatever the reason is. And, COPD doesn't only affect men, it affects women too. It
Absolutely.
affects anybody. It affects young people. So, the factor is, well, who's entitled to COPD? Who's entitled to it when they don't have to pay for it? Well, if you're on straight Medicare, right, you're entitled to it because Medicare says, okay, you're entitled to this treatment and it's free. Right? And because of, we're willing to provide the unit, we don't charge you for the unit or the mouthpiece, it's totally free for you. And one thing we can't understand, or we should be able to understand, is why more and more patients, as we stay on the show longer, we introduced this whole concept of COPD today, and we just did a big lung expose we did that in Las Olas, which we had tremendous results from the Lung Association, and people seen it. They've even came on the show a couple of weeks ago, the head of the Lung Association, how they were impressed with it. So, South Florida residents, Palm Beach, Broward, Dade County, if you know anyone, any family member, friend of yours that has COPD, tell them what you just heard tonight. All you got to do is call our office, 954-717-7027. Just call the office, and guess what? They'll advise you how to get on a COPD treatment. They'll advise you. If you don't have a doctor, we can send a doctor to the home for you to see if you qualify for it. So, again, I would say there's nothing to lose, Jane, to try it.
No, there's nothing to lose, and you don't have to wait until you're stage 4 COPD to look into using the IPV. The sooner you can use it, the better your quality of life is going to be.
We've even treated, I got a girl in her 30s, and she was one of my marketing people, and nicest lady, but she had asthma so bad, right? And thank God for the IPV. We gave her the treatments. It saved her life a number of times because she had asthma so bad she couldn't breathe. But with the COP, with the nebulizer and everything else, we really helped her, survive and live. And I know she might be listening tonight, and I know I'm talking about Diana. I won't use your last name, but the greatest gal I know. Is, we helped her with this whole IPV treatments, right? So she was a proponent of it. Told everybody about the treatments, and when you're suffering from it, if you're suffering from something, and you go to a physician, and he said, "Gee, I gave you a shot over here, but gee, I feel my shoulder now is healed." Well, you tell 100 people. Well, you're gonna tell everybody, right? So I remember going to a physician just recently. Fred, the producer of the show, was telling me about him, and I couldn't move my neck. Well, I went to the doctor. Well, it's just a neck pain. Well, he did it, gave me a couple of shots. Man, I healed in 2 days. Well, I told everybody about this doctor. They went up to see him who couldn't move their elbow from golf, who couldn't move their knee, who couldn't move their hip. I mean, professional athletes went to him. And how he helped them, whatever he was doing. He was a skeletal physician. How he helped all these people. So I think once you get the IPV treatment like you've done, Jane, you want to tell other people about it. And if you're sick, you'll go anywhere to get better.
That's right.
If you're sick and somebody got a cure, right? Hey, Jack Nicklaus is going to Germany to get stem cells in his back or shoulder. To Germany, right? Because how many guys went to Germany to get stuff treated for them? How many people went somewhere else to get treated because they hear about this cure, right? Because when you're in pain constantly, and you're not feeling well, really life isn't that great. They say about the golden years The golden years when you're 18 or 20 and 30, but have no gold, right? The golden years, now you got the gold, but you're too old to enjoy it.
They're not very golden if you can't breathe.
If you can't do anything, right?
Yeah.
Right?
It goes back to quality of life.
Goes back to quality of life. I mean, you see some guys are 80 years old playing tennis. Then you see some guys 70 years old sitting in a wheelchair in a nursing home. So it all depends upon your quality of life, right? Now, some people say, well, no, they abused themselves growing up. They did this, they did that. So the quality of life. But some people just have good genes and have a great quality of life, right? They can walk, they can run, they can swim, they can do things, right? So the answer to that is very simple. If you have something that's curable, or not curable, basically will make you feel better. COP is never curable. Am I correct, Jane?
Correct.
But you could be able to feel better. And if you could be able to feel better, just the other day I had my knees done shot up with stem cells. And Sunday I felt so great. I was walking great. So Sunday I felt like I could go play golf and do anything. Well, come Monday and Tuesday, I didn't feel so great, right? So your quality of life, it's back again. The pain's back again, right? So, once you feel well, no matter what age you are, you can do things. You can travel. But traveling isn't easy if you got COPD. Going places isn't easy, right? It's difficult on the patient. It's difficult on the spouse. It's difficult on everybody. And Roger, I got to tell you, Jane, I've known Roger as much as I've known you. He's not a complainer.
Nope.
Doesn't complain. He said to me today, I said, how you doing, Raj? He said, well, I wouldn't be doing so good if it wasn't for her, right? So he pointed to Jane, that Jane is really, taking good care of him. But again, he was so independent. Roger was independent, did everything. Now he's dependent, which affects him mentally, and it affects your manhood to a degree where you feel, I can't do this, I can't do that, I got to be dependent upon some people. So you get frustrated, right? So, but Roger doesn't complain. He just goes along with it, and she's a great wife because she doesn't complain about it. She says, I got to do what I got to do. We take care of people sick for years. But the answer is, how many people are out there know what to do? How many seniors know where to go?
They need to be educated about it.
We have to educate them, and that's the purpose of the show. That's why all counties agreed to sponsor it. We want to educate. Listen, when you're 30 and 40 years old, you can take care of yourself. When you're a baby, an infant, you can't take care of yourself. As you grow older, it gets more difficult to take care of yourself, right? See, I always say one thing, and I say this to everybody. You're once an adult, twice a child.
That's the truth.
You come in as a child, and if you live long enough, you go out as a child. Because why? You got to be dependent upon somebody to take care of you. And no one wants to be dependent. Everybody says, I don't want to depend upon my kids, right? I don't want to depend on nobody. I'd rather die first, right? Nobody wants to die either, that I know of. But guess what? You got to depend upon somebody. So we're trying to say to you, listen, if you have this problem, and your mother has it, your father has it, your uncle has it, and you're not a senior, but the senior that'll listen in, you know a friend that has it. Listen, there is help for you out there for COPD. We're only talking about respiratory disorder, COPD. We do all the other stuff too. All County does the PT, the OT, the speech, all that.
Home health.
Home health, we do all of that. But we're really catering to try to solve this COPD. Opioids is an epidemic problem, right? Everybody finally meets opioids up there. What are people doing? To feel better, they take these pills, right? They get addicted to these pills, right? Well, the pill's going to stop the pain. Well, guess what? Pills ain't going to stop COPD, your breathing.
That's right.
Right? So there's no pill for COPD.
Now, Jane said something interesting. It's not curable, but I think what we're getting to is it's manageable.
It is manageable with proper exercise, which you can only do if you can breathe. And the IPV allows that to happen. And the combination is something that's going to definitely improve the quality of life.
Definitely. And I was just reading. I'm always looking up to see COPD. What number it is for leading cause of death in the U.S. and heart disease and cancer is always 1 and 2. But I'm just kind of goofing around here as we're on, and I'm looking here, and it says in the year 2000 it was the 4th leading cause of death with 2.75 million people died of it. And I imagine, today it's much higher
Well,
than
there's
that. I'm going to look it
10,000
up.
baby boomers retiring every day.
Every day, wow.
And all those people lived in the era where smoking cigarettes was really cool.
Yeah.
And so even if you quit 20 years ago, which Roger did, your lungs already
And how many
set
people
up
work in those asbestos factories and all of those things, right?
all of those things.
Right. So when you're looking at people that say, see all these ads for this asbestos disease that the lawyers are saying, if you have this disease, what is it called now? This
Mesothelioma?
what?
Mesothelioma.
Mesothelioma, right? If you have this disease, I'm sure that's a form of.
I was just looking here. So COPD prevalence in adults in the U.S. now is 11 million people are affected with COPD, and it's still third or fourth leading cause of death in the U.S.
But
kind
don't
of on a
forget,
yearly.
COPD causes congestive heart disease, causes everything.
And it's
Right.
chronic obstructive pulmonary disease.
Right.
We're always using the acronym, so I just thought I'd say that. I actually didn't know what it was until about 5 years ago. And the reason I know, I'm a reporter, journalist, and I was actually interviewing a man. He said, I was a smoker, but you know what really may have affected me? I used to be a painter, and I sandblasted a lot. And I don't think I had my air intake that I'm taking in. I was taking in a lot of sand, and I was smoking. I was young, and we were doing a lot of jobs. And he said, I think that's when I kind of, that was a canvas for
he
this.
He never wore the protective gear either. So that's what
Yeah,
happened.
because back then,
Back then
it wasn't as many.
The importance wasn't
Yeah.
placed on that preventative care.
And Lou, I want you to also talk a little bit about pulmonary rehab and how all county health care can help.
Well, we're trying to work with Dr. Robinson. He has a pulmonary rehab lab. There's only 2 or 3 in South Florida that have it. Dr. Keith Robinson is a renowned pulmonologist, right, who believes in this product immensely. He's young, he's aggressive. Jane has interviewed him a number of times, and she's just amazed how knowledgeable he is, right? And he's up to date with all the new techniques that are going on up there, and with the sleep apnea and pulmonary diseases that we really suggest. I don't usually push anybody, but if you got pulmonary diseases, I say he's a great guy to go see, Dr. Keith Robinson. He has a pulmonary outpatient pulmonary lab down there on is a Commercial Boulevard,
Oakland Park.
Oakland Park Boulevard, Connor Oakland Park Boulevard, and I don't have the phone number there. Do you, Jay?
I can go ahead and look it
don't.
up while we're talking.
Yeah.
But the interesting thing about Dr. Robinson is he also, his first degree was in physiology. And so he practiced the physical medicine part of it before he became a physician. So when you put together somebody who understands the physiology as well as he does, he has a broader take on what's happening in your body with COPD. And so when Roger went to visit with him the first time, he looked and determined that possibly one of the reasons he wasn't doing as well as he could is the medications weren't right for physiologically what was going on in his body. So with Roger's permission, he changed his medication and he stopped 2 traditional medications, started a newer drug that's indicated for COPD, and he's doing considerably better on that medicine. And he went to see his pulmonologist at Mayo Clinic last week, and she said she had several patients on that new drug and was glad that he had found something that was making him feel better.
So no matter where you go, we're talking about Jay about this here. Doctors, if they don't see it, they don't read about it, they don't know it, they're not knowledgeable, they don't see it every day, they can't recommend it, right? Or I had 3 patients on it, but I'm traditional,
Well, it's no different than anything else.
Yeah.
When you're in one area of the country, they use a certain scope of drugs for a certain particular problem because that's what they're used to. Not that there aren't 100 other drugs that can do the same thing, but that's what their neck of the woods uses. And I think that's what happens.
In the commercial that really gets me about COPD, I always see this elephant sitting on the guy's chest, right?
Yeah, I see that one.
He can't breathe. Or the gentleman trying to go up with his granddaughter to go up the steps. He says, can we do it tomorrow, right? These are people who say, imagine you can't walk up a flight of stairs because you can't breathe. right? But your granddaughter's going up the stairs, and you want to be up there and say, can we do it tomorrow? Can we go out tomorrow? Well, let's hope there's tomorrows for everybody. But the fact is, we got to live in today. We got to live in today. Can't live in tomorrow. We hope tomorrow comes, but you got to get treated today for what your ailment is. So get back to Keith. Keith now, he does have this outpatient pulmonary center, which we're very interested in exploring because I think it's a great concept for people that can go to that's suffering from respiratory disorders to go meet with him, and it's like he puts you through a whole program. Whether I think he's got in there, I think he's got Tai Chi, he's got yoga, he's got massage, he's got weights, he's got bicycling. It's almost a pulmonary gym, but the whole concept is to build up your lung capacity.
Well, the problem with traditional pulmonary rehab that Medicare does pay for is that it's very limited. You get so many visits, and you go there 3 times a week, you do a prescribed regime, and then you get your certificate that says you've passed, you're done. And then the patient goes home, and they don't continue doing what they were doing there. They're afraid to do it because they're not monitored. When they're in regular traditional pulmonary rehab, their pulse oximetry is being done. There are people trained to take care of you if something happens while you're on the treadmill or on the bicycle. So they don't want to go to a traditional gym because they're very fearful. But in a situation like this, they go to this gym. When you are on their treadmill, you're being monitored with the pulse oximetry. And there are people there that can monitor your heart rate and make sure that your body is adjusting to the exercise.
Important to maintain that. That's something that
if you don't
needs,
maintain it, you lose
maintenance. Like on a vehicle, you got to maintain that kind of pulmonary rehab. And you made a couple other interesting points as well. They're getting encouragement from people who are experts as well. That builds their confidence when they go home. The home setting is not where you're going to do most of your workouts. It's not where you're going to make that leap and kind of get to that level that your quality of life level.
Right.
Well, the fear factor is eliminated. When you're in this facility, the fear factor is eliminated. You see other people with the same problem, right? So your fear factor is totally eliminated. You're not going to die if you do this because somebody is watching you, right? So somebody's protecting you. But if you're alone in the house and trying to do it, that fear, if I do too much, am I going to pass out? What am I going to do? What happens if I pass out? What happens if this? So the fear factor sets in. Fear does a crazy thing for the brain, right? Fear does a tremendous thing for your mental state, right? When you get fear, you just want to sit down and relax and say, I'm going to see.
Well, the biggest fear COPD patients have is anticipatory fear. They fear what's going to happen if they walk to the end of the driveway. By the time I get to the end of the driveway, I'm going to be completely out of breath and fatigued. So they just don't do it. So even if they're sitting there and they feel okay, they're not going to get up and do the act because of that anticipatory fear. They don't want to go to a restaurant because they're going to have to park in the parking lot, walk in. They fear by the time they get in there, they're not going to be able to breathe. So that keeps them homebound.
And places where there maybe is not, the elevator isn't as convenient, there may be a ramp, but it may be one of those where you got to go up a couple different levels or even a staircase as well. And without that confidence, exactly, their quality of life, and they're definitely homebound as well. So that's huge. I do have Dr. Keith Robinson's number for everyone. It's 954-900-5635.
Where's he located?
He's exactly like you said. It's Oakland Park Boulevard and Dixie Highway, right there on the corner of Oakland Park Boulevard and Dixie Highway. Not too far from our studio here in Boca Raton, probably within 30 minutes.
I don't think it's not too far from Federal Highway either.
Okay, yeah, Dixie.
Between Federal and Dixie.
Federal would be one block east of that. And I know the place well because I'm sure you've heard of this. Peter Pan Diner is right there on the corner. That's been there for years, since the 60s as well.
And he's worth going to see.
Yeah.
He's worth at least have one visit to see him. And if you have a problem, he's not easy to get into. I'll tell you, he's busy man.
Very busy.
He's doing a lot of lecturing. But if you're lucky enough to get in there, you tell him you heard his name mentioned by all kind of healthcare, the people that on the show, You and Your Doctor. He's been on your show a couple of times.
Mm-hmm.
We want to have him on again because we know we're pushing the idea of improve your. If you have COPD, let's improve your quality of life. That's all we're trying to do. Trying to educate the senior out there, and to educate him, he's got to be reminded it's his choice where he goes. You know, doctors can tell you go this one place, but if they don't know about all county health care, doctors can refer to their own home care agency that not that they're affiliated with, or they have a relationship with, or case manager can. But it's your choice. If they can't treat your COPD, listen, just tell them, I want to call All County Healthcare. I want to try this new treatment they got, right? I can tell you right now, if I had a cure for, hypothetically, I had a cure for cancer, right? And I said to the show, I got a cure for cancer, and everybody believed it. Everybody come down and say, give them a cancer treatment, right? Well, we don't have a cure for COPD. It's not going to cure you, but we will assure you you'll improve your quality of life.
And there's no contract with a home care agency. So if you decide to either leave the current home care agency and give All County a try, after 2 or 3 times something you don't like or it's not helping, there's no reason you can't go back to the other.
Right.
Mm-hmm.
So you do have that option as a patient to go to any home care of your choice.
Isn't that, though, how it is nowadays? Like, we have the internet, we have the phones, we can look up anything on the run, or we can Google things here and that. And I'm in the PR and marketing world is where I work in healthcare. And it's a term, and it's not a derogatory term, but I hear it a lot in the PR and marketing world, and it's medical tourism. So hypothetically, if my mom is sick and only the Mayo Clinic in Jacksonville can treat her, I'm going to do everything I can to educate myself, find those doctors as well, and I'm going to go up there and I'll stay the weekend up there if I have to get her treatment. And that is medical tourism, and it's about educating your friends, family. It's about awareness, like you said before, loved ones, peers.
But the unfortunate part of it is, I think if senior, I've heard this today, I got a call from a lawyer friend of mine. I said, gee, I got to call my dad. You should talk to him. He belongs to a coffee group of all seniors. So I talked to him, and he said, his name was Herb, and I said, Herb, your son-in-law asked me to give you a call to talk to you about me coming out just to discuss something about health care for seniors, right? Seniors are, let's be realistic, and let's be honest. Seniors have more and more is being taken away from them, right? They're not getting more and more benefits. This is the first time in the history of the state of Florida, I believe, that Florida Medicare Advantage programs, not straight Medicare, has superseded straight Medicare. So that means more people on Florida Medicare Advantage plans. I'm not saying the Medicare Advantage plans are bad. What I'm saying is I'd rather be on straight Medicare than Medicare Advantage plans because I can use any facility in the country with straight Medicare. On Florida and Medicare Advantage plans, I might have to only use their doctors, use what they offer me, right? And what am I going to save? I save a few dollars? But in the interim, I can go to a casino and blow $400 or $500 on the slot machine, but I want to save a few dollars on my health. Doesn't make sense to me. Your health is the most important thing you got, right? And I'm talking to you honestly, right? I don't want to save any money on my health, right? If it costs me more, I'm going to spend more money on my health because I want to stay alive. I want to be healthy. So if I have a program that the government said in 1963, I believe, under President Johnson, that when you reach 65, Medicare is going to be available for you. That means when you retire, you're going to have a health program. And it's been in existence all this time, and I've been paying for it. Why would I want to switch? What am I going to save? $100 a month? $200 a month? Believe me, I think my life's worth more than $100 a month or $200 a month. So I'm going to go to the best plan there is, right? That's why people that buy, a friend of mine said, he went to buy a big Lamborghini. And one thing he said to the salesman, he said, well, how much gas does it use? The guy said, if you worry about the gas, don't buy a Lamborghini, right? So if you can't afford the gas, don't buy the Lamborghini, right? So if you got a healthcare problem and you want the best healthcare thing, don't worry about the extra $100. You want the best. That's why these doctors have concierge medicine today. They say we're going to treat you the best. So how many people have bought concierge medicine? because that means they can get into their doctor faster. The doctor's going to see them faster. You know what I'm saying to you? Mm-hmm. So they got concierge medicines, people that have regular physicians. And, and if you've got a problem, like you said, everybody's Googling their disease today. Google, I think, is probably the biggest doctor in the world right now, because everybody Googles what's the problem with this disease? What's the problem? Where do I go for this disease? What's the symptoms of this disease, right?
Diagnose yourself.
We've all done it.
They're self-diagnosing themselves. Well, I don't have that, so I'm going to be all right, right? And then they have that white coat syndrome. They want to go to the doctor. It's going to fear.
Well, speaking of Google, they can Google the IPV.
Yeah.
I mean, there's no secret out there. So they can Google it and get their own information.
Mm-hmm. Make their own decisions as well.
That's right.
And if you Google right now, you Google IPV South Florida, I think we come up number one, all kind of healthcare.
Yeah.
So I think we're pretty close to number one. So, I mean, if you want to, if you got COPD and you want to find out the cause of the ailments of it, you can Google it. Mm-hmm. If you just got diagnosed with COPD, right? Mm-hmm. Remember, you want to go to you want to be treated. Google it. See where we come up.
Or go to allcountyhealthcare.com
right.
and you can get all the info without even having to click but one time on the tab
Jane,
there.
I think we only have a few minutes. I want to
We're about a minute. One minute.
Jay, thank you for coming all the way from Jacksonville. Tell us your
You
story.
are welcome. My pleasure.
Right?
You came up first.
We came up first?
Yeah, I Googled IPV treatment South Florida. There it is, allcountyhealthcare.com. Yes,
Wonderful.
Jane, thank you so much for telling your story and Roger's story as well.
My pleasure. I hope it reaches some people out
definitely
there.
for education and awareness. And for making the drive all the way from Jacksonville down here and to see Dr. Keith Robinson.
Hopefully that the 11 treatments we're going to give Roger in the future will both work.
Definitely. And hey, everyone, we're back on the air this Friday, 5:30 to 6, the How to Stay Healthy show. And then, as you know, every Tuesday, 6 to 6:30, right here on the station and All County Healthcare's Facebook Live page as well. Have a good evening.
That's it.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program